Good afternoon. I am Malvika Rawal of Ideal Business Partners. Today is May 17th, 2017. I'm coming to you from downtown Las Vegas, and this is the Healthcare Minute. Now, if you haven't already heard, the WannaCry ransomware is spreading across the globe. It's hit about 150 nations worldwide, taken out about 500,000 computers in the process. Several corporations, including FedEx, are down, and also several government agencies, including the UK's National Health Service. Now, ransomware like this blocks access to your files until you pay up, in this case about $300. Now, as a healthcare provider, you would be wondering, that's a very small ransom. If I pay this ransom and get my files back, I should be able to make that money back, no problem, right? Wrong. Getting locked out of your files by an unauthorized person is a breach of HIPAA. You are going to be liable for much more than just the $300 ransom that the WannaCry is asking for. Under HIPAA's breach notification rule, you must notify the Department of Health and Human Services, the HHS, of the breach. The typical response that HHS comes back with is to levy a fine and to put your practice under a corrective action. Now, what that translates into is way more money and a lot of time and a lot of scrutiny. Now, in the UK, WannaCry knocked out several of the NHS's trusts out of action. Providers of all stripes, including some emergency rooms, had to turn patients away since they didn't have access to computers which held the patient's medical records. So, now that you're good and scared, how do you protect yourself? The answer is right there, HIPAA. The technical safeguards that are required by the HIPAA security rule will not only help you mitigate the liabilities that you will incur as a result of the breach, but also protect you from the attacks in the first place. The safeguards require you to protect your computer through passwords, through encryption, and keeping your software up to date. They also require that you back up your data to a secure cloud-based server. Now, WannaCry exploits a security flaw in older versions of Windows. Microsoft had released a patch earlier this year to fix this security flaw. Anyone who updated the systems and installed this update is safe, so don't procrastinate on installing those updates. Now, if your data is backed up to a remote server, you can access your records even if your computer is affected. This will help you maintain the continuity of care for your patients. Plus, in the event that you do get breached, these preventative measures will help lower your fines and get you a less strict corrective action plan. WannaCry at this point has been out for nearly 7 days. The hackers have all major security agencies on their tracks, so we hope that this attack will die down soon. However, please do not rest on that coming true, because this is by no means the only such attack, and it sure as hell isn't going to be the last one.